sir and Purvi ma'am for inviting me here. I'll be talking about very important topic of improving compliance and adherence in diabetes. Very neglected topic, but we need to discuss. First question. So why we are treating diabetes? Question for treating diabetes is optimal long-term. Fortunately, what happens? Science challenge our practice. Many following also lifestyle. That's why we are talking this. So what is adherence? There are different definitions. People think patient taking medications, patient is following diet and exercise. This is what we call the FDA, US. It is the medication adherence or taking medication correctly is generally defined as the extent to which the patient takes the medication as prescribed by their doctors. This involves factors such as getting prescription filled also, remembering to take also, on time also, and understanding their direction. So this is what US FDA says. WHO also simplifies that the extent to which a person's behavior of taking medication, following diet and or executing lifestyle changes corresponds with the agreed recommendation. See here the word is agreed recommendation, which point we will be discussing about the shared prescription from a healthcare provider. So these are the simple definitions and for adherence. चल नहीं रहा है.
Can we have somebody from the team to help out with this pointer?
No, not pointer, slide changer. So it improves clinical outcome. Okay. So whenever patient is at good adherence, it improves clinical outcome, it reduces mortality, it reduces hospitalization rate, and overall health economics improves. So if you see studies in type 2 diabetes, every 10% increment in adherence improves A1C by 0.16%. The treatment satisfaction score, if you keep more than 100 for at least 6 months, you see nil hypoglycemia episodes in your patients. If your patient's adherence is more than 80%, it reduces hospitalization by 13%. The procurement of days, total days cover, if it is more than 80%, it reduces the 5-year mortality by 7.4%. This is again a big number. And mean procurement rate, if it increased by 10%, you can see the annual cost on health is reduced up to 29%. So these are big number achieved with this. And the reality is different. We can see the adherence is already overestimated, especially in India, where we think हमने prescription लिख दिया, that is over from our side. But it is already very overestimated, and we need to keep very high index of suspicion to detect non-adherence, because it leads to, you can see, more than 3 lakhs preventable deaths, more than 300 billion avoidable costs, and around 70% medication related hospital admission can be avoided with this. So you can see there are different methods to detect. There are so many methods, direct methods and indirect methods to detect non-adherence. But simple points, what we can do in our OPD is, first and foremost is the blood sugar report for glycemic control. Always remember, FBS and PPBS report won't just give you full compliance. We need to do HbA1c in those cases. CGMS many of the times helps. Sometimes when you have good rapport with patient, personal or good relations, when you take extensive history or you give motivational interviewing, patient themselves from them side they tell about the non-compliance. Sir इस टाइप तो ये महीने में तो ये हो गया, शादी हो गया, गोली नहीं हुआ, ट्रैवलिंग में मिस हो गया गोली. So this is when you do more and more interviewing and history taking. Sometimes we need to check empty strips also or empty cartridges for insulin taking patients also. Relatives history is again very important, where and sometimes the purchase records of refills or pill counts, the relatives tell from themselves. Many of the lifestyle compliance, when patient is doing exercise or not, you can ask the relatives to monitor their SAP counts also, or your team or your healthcare team from your clinic or diabetes specialty center can monitor them virtually also via messages also regarding the step counting in mobile or smartwatch for the exercise compliance also. So there are 5 components: patient related factors, health related factors, disease factors, therapeutic factor, and very important socio-economic factor. Due to lack of time, I am not going into detail, but there are more than 700 factors associated with non-adherence also. Again, there are modifiable factors and non-modifiable factors. There are enablers for adherence and disablers for adherence in chronic conditions. But I won't be going to details. What I'll be discussing about is my practical points, what I have learned in my OPD since last 10 to 15 years, what I have learned from researching various papers and guidelines. So I'll be discussing those practical points. We have 9 minutes left. So first and foremost is the adherence starts from the proper prescription. I know we are all expert in writing prescriptions, but there are many things in prescriptions which leads to proper adherence or sometimes poor adherence to the treatment. So first step is do make shared decision making in writing prescription. Shared decision making means you need to involve your patient in treating diabetes of those patients. So you need to involve them. Okay, not only you think you are the best doctor and what you write is the best treatment. Yes, we all follow guidelines and we all want to give our patient the best treatment. But patient's involvement in writing prescription is again very important. We need to include social factors also, age, marital status, pregnancy planning also. Educational status of the patient is very important. We need to see job types also and job timings also before prescribing the tablets, where the patient will be free to take medicines also. Elderly, very important, how family support is going on, who is going to give medication, who is going to remember the medication, who is going to inject the drugs or insulin or GLP-1. So these are again very crucial factor. The family support and caregivers is again very crucial. In India, what makes very important point is the economics also. Okay, if you write the best treatment available in USA, okay, what has been recently launched and marketed, many of the patients, I would say most of the patients in my practice area won't take it. Okay, so you need to see the cost economics. You need to see if you are writing a costly medication, see if the insurance company is going to pay, very less likely in India. And if there are so many corporate financings available which pays for our patients, the corporate of those patients, they pay for them. So need to see before writing costly medication, because cost of the treatment is again a leading cause of non-adherence in our country. So you need to involve patients about side effects also. Very important thing, it should be from the beginning. You need to explain your patient proactively. What we mean by proactively? You need to do it from yourself. Okay, patient आके नहीं पूछेगा. You need to do it from yourself. Side effect profiles must be addressed from the beginning. Explain all the possible side effects. You need to explain the side effect versus benefit ratio also. Okay, because the medicine is going to benefit the patient. You need to explain and weigh the side effects depending upon that patient's socio-economic, job status and educational status. Explain the non-serious nature of them. Explain about discontinuation will lead to no serious permanent issues. And explain quick remedies or tablets or for prevention of that. So side effect also includes hypoglycemia. Again, a very, very key determinant for your prescription. If the patient, once you start, suppose a very simple example, you start patient on insulin and the next week only patient goes into hypoglycemia and you have not said anything, not mentioned anything, the compliance of those patients will be very, very poor. He will definitely going to stop the insulin and sometimes going to change you also. So it's our duty to proactively explain them about the possibility of hypoglycemia, how to prevent hypoglycemia. Once it has occurred, how you can recognize hypoglycemia, what are the symptoms, and how to self-treat hypoglycemia. So this is our duty. So once you do that, the compliance with that medicine, sulfonylurea or insulin will be definitely longer. So it's our duty. The word very important is proactively from our side we have to do it. Simplify medication regimen, again very important thing. When we give complex regimens, our patients, no, they don't do it properly. Simple words. जो लिखा है वो लेंगे नहीं, कम लेंगे, skip करेंगे, नहीं लेंगे, miss कर देंगे. So that's where India loves fixed dose combinations. No, very easy, or the easiest or simplest method to improve compliance in India, because our patients, they don't like more medicines. So India loves fixed dose combination. In diabetes, we are fortunate to have so many fixed dose combination, and excuse me. And now we have combination of anti-diabetics with anti-hypertensives also coming. No, you must be aware about dapagliflozin with a beta blocker, bisoprolol, that is coming into market. That is already available. So India loves fixed dose combination, and that's where if you give those combinations sometimes once daily or twice daily, patients' compliance improves. Okay. Sometimes patients avoid, or they don't want lunch tablet when they are going for work. They don't want to take lunch tablet. Those busy professionals, sometimes for insulin also, they don't want to bring those insulin to office. They don't want to inject from themselves in front of other persons. Sometimes patient don't want to take meal time medicines. साहब ये खाने के पहले का याद नहीं रहता है, तो मैं भूल जाता हूँ. ज़्यादातर वो लंच का टैबलेट लिया ही नहीं है खाने के पहले का. So this is very common with alpha glucosidase inhibitors, where the tablets are meal time dependent tablets. You have to take at a proper time, otherwise the effect won't be there. Also, very crucial part is for compliance is you need to explain patient about the pathophysiology of diabetes. So this again comes into counseling part. It is very critical for newly diagnosed patient, because most of the newly diagnosed patient, when they come to your OPD, what they do, sometimes they take tablet. Once they are relieved from the osmotic symptoms, they feel better, they taper and stop the medicines. So we are not explaining them from the beginning. So what our teacher, my teacher is Dr. Vijay Panikar sir, they have taught us about the simple counseling, and in very simple language, little bit of serious note, but in a very promising manner they explain about the pathophysiology. They says, देखो ये डायबिटीज़ आने वाला आया है, जाने वाला नहीं है, ये जीवन भर का साथी है. ऊपर साथ में आएगा, लेकिन डायबिटीज़ ने आपको सता के ऊपर जल्दी ले जाने का प्रोग्राम बनाया. अ वेरी सिंपल वर्ड, एंड इट इज़ अ ट्रूथ रियलिटी. तो उससे घबराने का नहीं, उसको थोड़ा मान सम्मान दो, मतलब टाइम टू टाइम खाना खा लो, टाइम टू टाइम चलने जाओ, गोली लो, रिपोर्ट करके डोजेज हो, सब अच्छा रहोगे तो आपके चलते फिरते हंसते खिलते लाइफ खत्म हो जाएगी, कुछ नहीं होने वाला है. ओके, सो दिस इज अ सिंपल थिंग. द पैथोफिजियोलॉजी यू नीड टू एक्सप्लेन अबाउट द डायबिटीज, adherence to medicine, or the pathophysiology. So this is a very simple thing, and it is critical for all the newly diagnosed patients and defaulters. The psychosocial support, again, I think you must have heard the previous talk in type 1 diabetes, again very critical for our patient. Always motivate the patient during the what 2, 3, 4, 5 or 10 minutes you have. If you don't have time, divide your work with the educators also, dietitian also, they can do it, but always address the specific concerns and perceived barriers of the patient. Ask them कि क्या problem है, क्यों गोली नहीं ले जा रही है. Ask them proactively. This will definitely improve their compliance. Another session that was discussed earlier about the depression. So you have to actively search for depression, anxiety, and another term called diabetes distress. Again, these are separate topics, and many of those were discussed earlier in the previous session. So you have to actively search and counsel them. If required, you can refer them to mental health professionals. You have to involve the family members. Always, ideally, you should call them, all the patients, for counseling with their family members or caregiver, and you should give them management plan actively. You should involve them in them, because you cannot watch them from your clinic most of the time. Only you have contact period in your clinic, but family members have longest contact with them, and they are the main motivators or criticizers of them. But very important thing, always ask the family member not only to criticize the patient, ये मत करो, ये मत करो. Ask them to do motivation also, because we do from our OPD, but ask them to do motivation from at home also. And suppose someone has worked very good, ask them to motivate. Some of them follow diet during the festival times, motivate them. So these are small motivations will keep patients adherence. Very important ask what our teachers have told, what our teacher is also practicing right now at age more than 70, and what I am practicing in my city is giving your direct contact to the patient. So this is one important thing which definitely gives more confidence to your patient about your treatment. So very important thing for any emergency side effect.
One more minute.
Yes. So definitely they will be having more compliance. My prescription contains my direct phone number. I have only one phone number, and that is to all my patients. And you must be doubting both phone aate honge, but once you have counseled them, and usually if your appointment system is different appointment call, you don't get any other unnecessary call apart from any emergencies or side effects. Appointment, you click give fixed appointment, prior reminders, calls, we all are doing, minimize the waiting time in clinic by diverting the time to educators, dietitians, or showing them video recordings also, or some diet recalls also. Video consultations are again a very critical part to improve the compliance. Technology part, I need to put it first, but what I have gone through, the current application of technology in diabetes care right now in India is very, very less. And all these AI, chat GPT and all those things, the founder of chat GPT has yesterday or day before yesterday, so just said AI is just a bubble now. You can go through it, and I don't think current implication which has major importance in clinical practice right now, we don't know about future, but reviewing CGM data is very critical. Real-time CGMS, again a very excellent educational tool and motivation for the adherence for the patient. Remote monitoring is there. Important aspect, what is currently being very, very successful is the health platforms also. And once you have team of health professionals, dietitians and educators, the constant, I wouldn't say constant, but frequent at an interval, context with the patient definitely improves adherence. For diet recalls also, diet photos also, step counting photos also. So they are calling the patients or they are messaging the patient to improve the compliance. The last part is your body language matters. Very important thing which makes this you stand out from other doctors also, and your body language also improves the compliance. How positively you meet them, how positively you reinforce them. So my teacher has always said this one line, you have to always smile in your OPD, smile bigger and smile more bigger. So thank you very much for the talk.
Thank you for the